All right, so we've got a mountain of info here on the Hamilton G5 ventilator. You definitely did your homework.
Yeah, it seems like you're really looking to get a handle on this critical piece of equipment.
Absolutely. We got all the bases covered: manufacturer's notes, user guides, the works.
Well, great. And trust me, there's a lot to unpack. This isn't your everyday ventilator, The Hamilton G5, it's a mainstay in ICUs for a reason.
Let's dive into those features a bit more. What exactly makes them so innovative?
Well, let's start with IntelliCuff. Imagine this. You have this tiny device, right, integrated into the cuff of the breathing tube. And it's constantly monitoring and adjusting the pressure inside.
Okay, that's pretty cool. But just to back up a bit, why is managing that cuff pressure so crucial?
Ah, good question. See, maintaining the correct pressure in that cuff, it's essential for preventing complications. If the pressure is too high, it can actually damage the trachea, leading to scarring, narrowing of the airway, all kinds of problems. But if it's too low, well, then you risk air leaking out, which means the ventilator might not even be doing its job effectively.
So it's like finding that sweet spot and making sure it stays there. Not too high, not too low, just right. We've talked a lot about the IntelliCuff, the cockpit, all these impressive features, but what about the nuts and bolts of the machine itself?
You want to get into the nitty gritty. And you're right, there's a whole other level there. Like, we haven't even touched on the gas mixing system.
Yeah.
And that's crucial. It has to ensure the patient's getting the right concentration of oxygen with every breath.
Right. And speaking of crucial, I remember the sources going on and on about those breathing circuits, something about different circuits for different patients, like based on size or something.
Absolutely. The breathing circuit, it's what connects the patient to the ventilator. But it's not one size fits all. Not even close. A tiny baby needs a much smaller circuit than, say, an adult.
Wow, see, I never would have thought about that. There's so much precision involved in every aspect of this.
No,